Item 134, receive a comprehensive year-end report and PowerPoint presentation from the CorrectHealth to include a review of any and all services rendered to East Baton Rouge Parish Prison during 2019 by Councilwoman Charna Banks. Council members, we'll do the report first. We'll listen to the report, and then we'll have the public hearing after the report. If you give your name and...
My name is Jean Levette. I'm the Director of Clinical Services in Louisiana for CorrectHealth.
Yes, ma'am.
Is the PowerPoint going to be shown?
Yeah, it should be. You gave it to him,
I was looking for it there. I just don't have a copy of it with me.
Okay. You need a copy?
Do you have a copy? Thank you so very much.
Is that it? Oh, I don't know.
Just the four, that's it.
That's good.
Thank you.
The first thing that I would like to talk about is over the last 2 years, CorrectHealth has worked towards an attained NCCHC, which is the National Commission on Correctional Health Care accreditation. It's a national accreditation of the East Baton Rouge Parish facility. The accreditation goes to the facility, not to medical or to the Sheriff's Department. Warden Grimes, Major Fontenot, Susie Hatfield, Phyllis McNeil, who's the administrator there, worked very hard towards this accreditation. The NCCHC accreditation is similar to what hospitals use that's called JCAHO, which is an outside accrediting body to come in to make sure that a minimum of requirements are met. The survey consisted of a 3-day audit that was conducted by 2 people. Tracy Titus, who's a registered nurse, who's the Director of Accreditation for the National Commission of Correctional Health Care, and Dr. Alvarez, who is a medical director in the Maricopa County Jail System of a 2,400-bed facility. The survey results are actually in the emails that y'all were sent today. This accreditation requires an annual report and resurvey every 3 years. On the initial accreditation report, there were 5 things that the accrediting body said that they needed more information on. And then on December 4th of 2019, the facility, after submitting this extra information to the NCCHC, granted the accreditation. The accreditation letter went to Mayor Broome, and I have a copy of the actual accreditation certificate with me that went to the jail and is sent in the lobby. I didn't know if anyone was interested in seeing it. Also, the other thing that I brought with me is the 2018 accreditation standard book, which is the standards that the jail has to meet for this accreditation. And I didn't know if anyone wanted to see the standards. And I do believe everyone has a copy of the statistical reporting from 2019. Okay, no problem. The first thing that's listed is the average daily population of the jail. This is a number that we get
on the screen. Can you? I mean, it's going to be probably hard to see it up there. I understand that. I mean, they're going to try to show it, but it's very small and hard to read.
Yeah, my understanding is that that was in the packet that was sent, and that there was a copy. There's just a slide about. No, ma'am, not the.
They can pull it up. It's going to be hard.
Yes, ma'am. No, ma'am, I was not.
The reason we deferred it before is because it was not where the audience and the TV can see it. That's what they requested. That's what all of the persons have.
Okay. I did not prepare the PowerPoint, ma'am, so I apologize, and I'll go through it as best I can. Yes, ma'am.
Go.
What we have is up.
Okay. The first things, okay. The first things that are listed are going to be the average daily population of the jail, how many are housed for the Department of Corrections, and how many are U.S. Marshal or federal inmates. The next is going to say the total number of facility intakes and bookings. The second thing is the number of total intake receiving screenings. Whenever someone comes into the facility, one of the first steps they go through is to have a medical screening done. And this is where we take their initial information, do their vital signs, and make sure they are medically stable to come into the jail. The reason why these two numbers do not always match is there are times when somebody comes in, we don't complete their screening, we defer them to the hospital prior to being booked. There are people who may get out prior to their booking being completed. There are times that people would come back from other facilities that didn't get a screening as they came back into the facility, if they were out for court for one day or those kinds of things. Going down the report, we report the number of physical assessments that are done within 14 days, the number that's over 14 days, the annual physical assessments that happen greater than a year, and then the physical assessments within that time period. Health service requests, if you see where it says the number of sick call requests submitted is actually the bottom line in this section. Those are the total number of requests per month that we receive. Dental, medical, and mental health are breaking down as to which particular area the inmate was asking to be seen for, whether or not it was a dental, a medical, or a mental health problem. The medical encounters are sick calls only. The number of total encounters by the MD, by the mid-level practitioner, by the nurse, and then nurse productivity. Nurse productivity includes how many people had their blood drawn, how many blood pressures were taken, how many CEWA checks, how many interactions over the course of the month did the actual nursing staff have with the inmate population. The next section is going to be isolation and segregation, how many rounds were made in a monthly basis by the nursing staff and by the mental health staff. There are different parameters for who does what assessments, and it's based on the level of isolation and where they are. The next is going to be grievances, the total number of grievances per month submitted by an inmate, and then the total number that were sustained grievances, meaning where after investigation it was found that the inmate was correct and corrective action had to be taken for that particular issue. The next thing is going to be what's called unscheduled encounters, which are man-downs and pre-incarceration diversion. Man-down would be something similar to an inmate having a seizure in the housing unit, and medical would have to respond to that. It was an unscheduled encounter. The next thing that we're going to look at is the chronic care in the facility. This is chronic care, how many people have chronic medical conditions, diabetes, hypertension, seizures. And this number fluctuates, varies greatly depending on the inmate population for that month of time, depending who's there. And then it breaks down to how many inmates there were that fit into that category, how many of these people were seen by the in chronic care clinic by the mid-level provider, and how many were seen by the physician. The next is the number of pregnant inmates per month that were in the facility, and the number of births while in custody. All of the births happened in the hospital. It says, the next section says, infirmary, special needs unit, or medical observation. East Baton Rouge does not have a medical infirmary. They have a special needs unit. This is where people with disabilities and special medical needs are housed. If somebody's housed in a wheelchair, and these are male inmates, if they're in a wheelchair, if they need a CPAP, and those kinds of things, this is who would be housed in the special needs unit. The next is going to be the number of encounters. The special needs unit at the East Baton Rouge Parish Jail only handles mental health patients. I apologize, does not handle mental health patients, only medical patients. So you'll see where the MD did the rounds there and not the mental health providers. The next division is pharmaceuticals. It says the number of patients in the course of that month that were on medications. The second number, the number of medications, this is the number of administered doses of medications that were given. The next are the mental health numbers. The mental health caseload is going to be the first number. It's going to be usually somewhere between 300 and 600, depending on, again, the population in the jail at the time. How many people were seen by the psychiatrist, the mental health MD. How many people were seen by the medical health provider, mental health provider, I apologize. And then how many were seen by the LCSW or LPC. How many people had a commitment evaluation, which 1013, which we do not do in Louisiana. That would be a PEC in Louisiana, and we don't PEC out of the jail, which is a physician's emergency commitment. And then how many groups are run by CorrectHealth and the group participants. The next is going to be the numbers on dental care. It's going to say the number of dental procedures that were done a month, dental exams. And usually it's between 50 and 90, and then it goes through to list extractions and x-rays and fillings and how many people had annual exams. The next category, specialty visits. The first one is going to be emergency room visits. And it ranges from 20 to 50, again, depending on what's happened in the jail that month. How many people were transported by EMS, how many hospital admissions, and how many inmate days were in the hospital during that month. Outpatient visits, this is going to be the number of people who went off-site, including dialysis treatments, and these are going to be to clinic appointments to follow up, like with the eye doctor, with the cardiologist, those kinds of things that were off-site. Next is going to be on-site specialty visits. This includes the x-rays that are done on site, ultrasounds that are done on site, the inmate deaths. It's going to list the number of suicides, the number of hospital deaths, the number of total facility deaths. This means the number of people that were incarcerated who passed away during that period of time. TB testing. This is going to be how many TB tests were planted. These are planted at intake when people come in. With tuberculosis being an airborne disease, we want to make sure that we've tested everyone as they've come in. The number of read is greatly different because in the 3-day period, it's 72 hours prior to reading a TB skin test. During that period of time, a lot of people get released. But we've planted it as they come in. So that's why there's a difference in those numbers. It lists how many people had a positive skin test. This means that they tested positive, possibly for an exposure at some point in time. And then we go into how many, the chest x-rays listed above on the top of that page. It's going to be on-site chest x-rays. Anyone who has had a positive test or a previous positive test is then x-rayed. HIV care, we usually average between 50 and 70 HIV positive inmates a month within the facility. And this is going to tell you how many people we did screening tests on, how many people in the facility were positive, how many were new diagnoses, and where it says patients receiving ART, that's antiretroviral therapy, that's that's medications for HIV. Hepatitis, again, it's going to tell you how many patients in the facility are being in the chronic care clinic, how many are new diagnoses of hepatitis B or C, how many people were diagnosed, and how many people did we notify for the state health department. The same thing goes for the section for STDs. How many people did we test with RPRs, which is a test for syphilis? How many people were positive for syphilis, gonorrhea, chlamydia, how many people had skin infections, and how many people it was reported from there.
Is that all? Yes.
That's all in that, but I just wanted to make sure we were.
Okay.
We're still writing.
Council members, we're going to have the public hearing. Then we'll have the.
Well, I just wanted to, if there was anything else. The other thing that was that I was asked to talk about was the medical staffing levels, and that that we have maintained the staffing level. We have a staff of approximately 40. And that during the first year, we had hired 19 people that had been from the previous medical service at the jail. And in year 2, there was a total of 12 of those people who continued to work for us, because I do know that was a question. Okay?
Okay. Council members, we'll have the public hearing.
Good. Thank you. Thank you very much.
We'll have the public hearing, then we'll close it and have questions. I'm going to say, look, before I read off names and who's, I know very passionate about this. I understand. I just ask that everybody shows the respect that we will give you and the respect back towards us. That's all I ask. Item 134 is for the CorrectHealth 2019 report. So I don't know if y'all want to speak on that item or it's the next item. So that's what I'm just trying to, so make sure if you come up for this item right now, this is for the 2019 CorrectHealth report. This is what it's about. That's the topic. And if you want to come up for the next one, which is about the task force and the problems, so that's what I'm just trying to point out to everybody. So first up, if they want to speak on this item that I have is Chiquita Henderson. Is there a Chiquita Henderson? Okay, I'm going to go down to Krachika Samantha, S-A-N, S-A-T-H-A-N, A-M. I'm just going to go down the list of the names first, and then we'll...
All right, great. Hello. So I'm here. My name is Karthika Santhanam, and I'm here with the East Baton Rouge Parish Prison Reform Coalition. And we have several questions regarding some of the information that we've uncovered in the report. My focus is the problem with the psychiatric evaluations that are happening within the facility. Tragically, as you may all already be aware, there was a death by suicide in January of this year. Mr. Shabad Claiborne was placed under a mental health protocol when he was first admitted to the facility and then removed the following morning. And one of the biggest problems that we've identified is that it seems that the staff person at CorrectHealth that's responsible for doing the psychiatric screening may not necessarily be doing a proper evaluation. The person performing the evaluation, first off, should be a licensed psychiatrist. But the problem is if the same person that's doing the evaluation is also providing the treatment, then there's clearly a conflict of interest issue there if the screening isn't capturing the person's mental state and the need to properly address it. So our question is really what are your thoughts on how
We'll get to
that's going
that
to be
question
addressed?
once everybody, after the public
Okay.
hearing, we'll ask that.
Thank you.
Thank you. Next, is Michael Cahoon. Is that Michael?
Hi, my name is Michael Cahoon, and I had a question about the contract itself for this year, which the report, I think, is part of because it's implemented under contract. And I just had a question about how the contract was written and compiled that's in effect now under CorrectHealth, because based on review of the contract and others similar to it around the state and in Georgia, it appears that certain services have been eliminated and excluded that are present in other contracts. And also identifying the reason that the payments rendered to CorrectHealth for the services this year are rendered a month in advance instead of being on a reimbursement basis, as is common in other contracts. And then just one thing about the accreditation mentioned, the NCCHC, which provided that accreditation, has a position statement on solitary confinement that it put out in 2016 that says juveniles, mentally ill individuals, and pregnant women should be excluded from solitary confinement of any duration. Given the stake that's put into this accreditation, I was wondering if the EBRPP is meeting that standard. Thanks.
Okay, thank you, sir. Next, Lorraine Davidson.
Hello, I'm Lorraine Davidson, and I have a question on how the scope of practice is determined. Usually in traditional settings, the LPN and RNs have different, have delineated areas of service, but it appears in the East Baton Rouge Parish Prison that LPNs are doing the job of RNs and nurse practitioners are doing tasks that RNs normally do, and that social workers and counselors are being used instead of psychiatrists and psychologists. So I just want that clarified. Thank you.
We had the psychiatrist. We already had that question. You finished? Okay. Brandy Hebert.
Hello. So based on the report and the written contract, please clarify the reason for proprietary policies while performing a public service. The contract states that written policies are available upon written request. However, those policies cannot be discussed.
Next is Reverend Anderson.
We have a question based on the report and the written contract. Please clarify who performs assessments and who performs evaluations. In a traditional setting, assessments are performed by RNs, nurse practitioners, and evaluations are performed by nurse practitioners and MDs. It appears to be much different in the East Baton Rouge prison. If you can please provide what allows LPNs to perform services in the prison that are not allowed to be performed in a traditional healthcare setting.
Jennifer Harding.
Good evening. I have a very short question, but before I ask it, I would like to let y'all know that the live stream hasn't been working this entire meeting, so people who aren't here are not able to see it. And also, when this item was originally introduced, the council administrator said that the report would be added to the agendas for the public to be able to see in advance, and that didn't happen. We appreciate the copies that were handed out in the room, but we still need to be able to get these sort of things to the public in a timely manner, so that people can actually have a chance to digest them and be prepared before they come in here to speak. So I would appreciate if we could maybe somehow get that up to where people can get that online after this meeting. And so my question is simply, could CorrectHealth please clarify how the number of staff per job class is determined? Thank you.
I'm sorry, can you say that again, Jennifer? Which the number of staff?
How the number of staff per job class is determined.
Okay.
Point of order, just for a second. Do you guys have the questions written down in one document so that if they can't be answered tonight, that somebody, so you do, so you can submit that to this body? Okay, thank you.
I mean, I appreciate it. My shorthand's not very good.
Scott is struggling up here.
Thank you. Tammy Jones.
I think they want, also,
I think we're going to try to answer them tonight, but we're just trying to see if you got a list of questions.
I know, we want to make sure that we have them right, though, because Scott is trying to write as they talk. So we want to make sure we have clear
just call them back
questions.
up. Yeah, but I do know they want the audience to hear each question.
Sure. Yeah, okay, fine, thanks.
Yes, ma'am.
Yes. Based on your report and the written contract, please clarify how mental health services are being provided. Also, what are the credentials of the mental health providers that assist the psychiatrists? It has been stated in the report that over half of the detainees require mental health services. Therefore, 650 individuals require services. The psychiatrist is contracted for 8 to 12 hours weekly to serve roughly 650 individuals. How could this be adequate mental health care?
Thank you, ma'am. Tiffany Yang.
Hi, everyone. Good evening. I'm here with the East Baton Rouge Parish Prison Reform Coalition, and I have two questions. The first relates to the reporting requirements under the contract. When people are sent to the parish prison, it's as if they're erased. Transparency and accountability are of the utmost importance, especially given what we know has already happened at the parish prison. There's been 41 deaths since 2012, 17 deaths under CorrectHealth, and family members have not been notified of their loved ones in crisis, in comas, in desperately terrible situations, sometimes for days. Now, the contract includes very vague language about how reporting will be provided in a manner and time frame agreed upon by both parties. But my question is, why does the contract not identify which measures will be reported on and the deadlines for those reports like other contracts? My second question is, based on the information that was provided today, the statistical reports, it appears that the number of patients who receive HIV-positive treatment is sometimes less than half than the number of patients that are identified as HIV positive. And so my second question is, why does that number differ so immensely? Thank you.
Miriam Nemeth. Sorry.
Good evening, council members. My name is Miriam Nemeth. I'm a lawyer with the Advancement Project in Washington, D.C., and I'm here to support the East Baton Rouge Parish Prison Reform Coalition. The questions that I have based on the report and presentation this evening are, we would like some clarification about how special needs are handled in the East Baton Rouge Parish Prison. How are disabled detainees serviced, and can you provide any other answer beyond solitary confinement? We've heard stories from people that they've received spider bites that required serious medical care, and we were wondering how the spiders in the mattresses are being addressed, how are bed bugs being addressed, how are pregnant women being housed. We saw a report just now that 4 or 5 women have given birth in the past year in the facility. How is that being handled? How is food poisoning being eliminated? And how are the rats in the stew being addressed? We're not requesting that citizens are booked into the Hilton or into the Indigo Hotel where I'm staying this week, but we're demanding a review of the current healthcare service provider in the form of an external audit, an update to the services being provided and to the requirements of who provides those services, and most importantly, an external compliance officer and contract monitor. Thank you very much for your time and attention.
Ashley White.
Good evening. My name is Ashley White. I'm a bail disruptor and client advocate for the Bail Project, and I'm also a member and supporter of the East Baton Rouge Parish Prison Reform Coalition. My questions are in regards to the reporting of deaths at the prison. Based on the report and written contract, we'd like to address how, to whom, and how often are deaths reported. And we want clarification on the information we received from our Freedom of Information requests do not match the number of deaths that have been reported nationally, and we're concerned that that information may be inaccurate. We'd like to get some more clarity on those data points. Thank you.
Linda Franks.
Good evening. Based on your report and the written contract, please, we would like for CorrectHealth to please clarify how emergency situations and emergency care is rendered. I know in my personal experience, my son's death could have been avoided had he gotten adequate medical care in an expedient amount of time. So it is very important that we know how these individuals who are being pre-trialed detained, please understand that they have not been convicted of any crimes. The majority of the deaths are of people who are awaiting trial, so they are citizens of Baton Rouge, East Baton Rouge Parish, and should be treated humanely as such. So we would like to know how these medical services are being rendered. We're not requesting that individuals be housed in a Marriott hotel or given any type of sudden luxuries, but what we do require is that there be accountability for the deaths and the injuries that are occurring to our citizens that are being pre-trial detained in a facility that taxpayers are paying for. So thank you for your time, and we hope that these questions can definitely be answered to our and to your satisfaction.
Rosa Hill.
Good evening. The question that I have, and based on your report and the written contract, please clarify how the intake process is performed. Based on my observation and the information provided, the intake process takes approximately 20 minutes on average. A detainee is processed in the prison. A medical assessment is done by an LPN. A mental health assessment is performed by an LPN. The detainee is fingerprinted and booked all in 20 minutes. How can that be?
Please, so we can move along, please. Edward Alums.
That's me, but can I please move my comment to item 135?
Yes, sir, that's fine. Shamitra Gonzalez. I'm sorry.
Hello, thank you guys for hearing me. I have a comment to make, not necessarily a question, just want to make sure that's okay. But my name is Shemitria Gonzalez, and I'm here representing the Louisiana Stop Solitary Confinement Coalition. We have over 150 members, and we're still growing. We are here for one reason. There is a crisis in the Eastern Baton Rouge prison. They have had over 41 deaths, and I could go on and on about the facts and statistics that will make you guys feel worse, and I don't want to do that because I want to bring a positive energy here to just say that all that we look for is accountability and for our questions to be answered, and I thank you guys for having me.
Thank you, ma'am. All right, ladies and gentlemen, this is a public hearing. Anybody wants to speak on item 134 on the Correct Health? Item 134. Yes, sir. Please give your name and address, please, sir.
My name is Robin Mulder, 9265 Bermuda Avenue, Baton Rouge. Commenting on the report as just presented that no one had any time to look at, but there's several things that I would ask the council to consider asking more questions about. No medical doctor sick call visit at all in August. Did they just not have a doctor for a month? What happened there? Even though between 49 and 94 dental exams were done every month in this report, not one permanent filling was installed, and exactly one in January, temporary fillings. They pulled teeth. So we're at about 1890 level dental technology as far as what was done to these citizens. Again, these are not necessarily convicted criminals. This is someone who just couldn't make bail. We're punishing them.
Please.
Why? Okay, next. In this report, between 5 and 17 inmates were pregnant women, averaging over 8. Not a single OB/GYN exam was made the entire year. Is that women's health? Is that what you want? Is that what you'd expect your daughter to see if she couldn't get out because she couldn't make bail? Grievances. Of course, most of them were denied. Who is the independent examiner? Or is the person reviewing the grievance somebody who has a conflict of interest? Do you see the grievance reports? Who knows what those reasons were that they were denied? Thank you.
Ladies and gentlemen, the public hearing, we speak on item 134. Yes, ma'am. If you give your name and address, please.
Keena Reed, 1619 Oleander Street, concerned citizen of EBR. I have 3 quick questions. The first one being, how is Correct Health gathering the data? A subset of that question might be, what is the software or the instrument being used to gather the specific data, the numbers we saw in tonight's report? The third question is, can we get some clarity? Initially, the reporter told us that there were 40 people on staff. So I am imagining that that does not include the amount of people who are actually identifying as providers. So if we can get some clarity about the difference between staffers and provider and what those numbers really are, I'd appreciate that. Thank you.
Ladies and gentlemen, the public hearing, speak on item 134. Can you give your name and address, please, sir?
Of course. My name's Drake Brignac of 1524 Charlotte Avenue. Thank you for the opportunity to speak. I'm a concerned citizen and also a member of Tiger Prison Project at Louisiana State University. And I briefly wanted to come up to address one of the notes referenced in the presentation, which was the NCCHC accreditation. And while that may have given the EBR Parish Prison a seal of approval, I'd like to make the council aware of the fact that accreditations are historically problematic because they are operated within themselves. They're nonprofit organizations that don't need to disclose their information, and there is really no accountability if an accreditation turns out false. This happened with for-profit universities in the United States less than a decade ago, and with NCCHC especially. This came up in 1999 in a court case in Texas, Rouge versus Johnson, where the court said that while NCCHC accreditation does bolster defendants' claims that its medical care system is functioning constitutionally, the accreditation cannot be dispositive of such a conclusion. So when you consider the East Baton Rouge Parish Prisons issue, I'd like for you to recall the fact that accreditations are not entirely seamless. Additionally, a number of prisons and jails across the United States that had these accreditations suffered issues. In 2008, the Department of Justice Civil Rights Division issued a message to Worcester County Jail and House of Corrections saying that their solitary confinement conditions were unconstitutional. However, the county denied such allegations because of their accreditation from NCCHC. Additionally, Harris County Jail in Texas was reaccredited in 2014, and a year later, the Houston Chronicle found that 19 out of 75 deaths in the prison were treatable or preventable. And additionally, there were two plaintiff witnesses in the Ruiz versus Johnson's case that explicitly served as NCCHC accreditors, and the court gave this opinion as a result. At least two of the plaintiff's experts who testified about profound shortcomings in the quality of care in Texas prisons also work as NCCHC accreditors. So I'd like for you to consider the shortcomings in this accreditation while you consider any punitive action or while you consider the words of the other individuals in this room. And I'd also like to close with the fact that while this is a private company, the sole purpose of government, whether you're on the left, the right, a libertarian, a Democrat, or Republican, is to defend the nation, defend its citizens. And I believe personally that by selling this health care to a private entity, we are derelicting our duty to serve our fellow countrymen, our fellow citizens, and I believe it's very important to also consider our role as a public entity and how we might need to provide public services. Thank you very much.
All right, ladies and gentlemen, it's a public hearing. Want to speak on item 134? All right, seeing none, we'll close the public hearing. Council members, Councilman Watson, if I could ask, it's kind of and I'm going to say it's a two-way street. I know y'all were asking for the report that they had. If you have a list of the questions, and all these questions came up, if you could please send them up if you have them, I'd appreciate it. Councilman Watson.
Can I get someone from CorrectHealth to come up? For starters, I believe the handouts that we got are missing a vital page in here that talk about inmate deaths. I think that is very important for us to get that information. In the blue packet. Okay. Thank you. Apparently it was not in the packet that looked like it was up there, but a separate
You got
packet.
it, okay.
Either way, let's, gentleman asked a very good question that was, just happened to be a question I was going to ask you as I was looking at that.
Yes, sir.
Who or what position acts as the intake of inmate or pretrial citizens' grievances?
The grievances go through the jail system. They determine that they are for medical. The jail gives them to medical. The health service administrator then investigates them. We turn them back into the sheriff's office, whether it's founded or not founded.
So the grievance is, pardon me, ma'am, the grievance originally that is initiated by either the person in pretrial or the inmate.
Yes, sir.
Reaches out to a prison guard?
No, there's a formal form that they fill out, that they have
Okay.
access to in the units.
Okay.
I'm not 100% sure of the East Baton Rouge procedure for them getting the form.
Okay. Is there someone here on your behalf that would understand how they received that from?
That comes from the sheriff's office, sir, not, I don't
Okay.
believe anyone is here.
Okay, so the sheriff's office, through a form that's received, I would imagine through guards or through folks that run?
There's a box, I believe, there's a locked box that they go into,
And
it's picked up by a correctional officer.
okay, so
and
a
then brought to-
correctional officer
Yes.
sees the grievances?
Yes.
Okay. Who then determines what is a grievance or the next line below a substantiated grievance? Who is that?
In medical, it would be the health service administrator who investigates.
This
the
is
com- the
one
complaint.
person who is the health service administrator, or do you have multiple people that shift off?
There's
and do
one
that?
person as the health service administrator.
That is full-time at the prison?
Yes, yes, sir.
Okay.
It's a registered nurse.
A registered nurse?
Yes, sir.
Okay, that brings me to another question that was asked earlier.
Yes.
It seemed to have been pointed out by one of the questions asked by many of the folks that come up here, all with good questions, that
Yes, sir.
there are LPNs performing jobs in a correctional facility setting that they would not be able to perform in a non-correctional facility hospital. Is that the case?
No, sir. It is not.
Okay.
The intake screening that is done at intake, which I think was one of the points of contention, that screening is performed to make sure that their vital signs are stable, that their medical conditions are stable, that they don't have any major injuries that are going on at that point in time. If they have any questions about that, there's an RN supervisor on who can then be called over to come and look at that further.
Okay.
They also have access to a physician or a nurse practitioner 24 hours a day, 7 days a week that they can call. We also have the ability to put them on telemedicine in case the provider has any questions and wants to see the person at 2 o'clock in the morning when there's not a physician there.
Okay, let's go back to let's go back to the intake that you brought to. If you've got an LPN looking somebody over, I could tell if you came in bleeding. I mean, that's
Correct.
something that I could be able to do.
But if you came in and your blood sugar, if
Certainly.
you're diabetic
Certainly.
and we test your blood sugar and it reads high, that means it's higher than the scale of the glucometer can read, which is typically over 500 or 600, depending. Either way, when we don't know you, we don't know your condition with you coming in from the street, they would be deferred to the hospital.
Certainly. What about in this? I don't know if it's 20 minutes, if I'd let you address this 20-minute number, and let me finish the question
Yes,
first
sir.
before you answer.
Yes, sir.
It was mentioned that the screening, both physical and mental and fingerprinting, all is accomplished in 20 minutes. Is that, are they talking about an average of this amount of time happening, or is this considered to be, we need to get this done in 20 minutes, ensure that it's done in 20 minutes?
No, sir, I believe that's an average. We
Okay.
actually have had complaints from the East Baton Rouge Sheriff's Office that we don't move fast enough.
So you're putting this on the...
No, sir, what I'm saying
It sure
is-
sounded like it.
No, what I'm saying is we take the
Hold one
amount of
second,
time
Jane.
that...
Hold 1 second. Look, I'm going to ask you, please. I mean, she's trying to answer the questions, and I'm going to ask you, please. You clapped earlier for me, so come on now. Please,
I'll ask for my
just
extra
please give her
time.
respect to where
We
she can
take-
answer the question. You may not like the answer, but she's going to answer the question.
We take the amount of time that
I'll
is...
take my extra 5.
We take the amount of time that is necessary. So the road
Certainly.
deputies that are standing there sometimes have
And
gotten
the
frustrated with us because we're taking longer than the 20, and it's not a set time. If a 21-year-old comes in who has no medical problems, all of their vital signs are stable, they have no injuries, and the nurse finishes their mental health screening, their medical screening, their dental screening, and there's nothing that triggers further evaluation that's needed, they may take 15 minutes. They may take 10 minutes. If a 55-year-old gentleman comes in who has diabetes and hypertension and has had a stroke in the past, he may take 40 minutes to screen it. It's all dependent upon the person and what their individual issues are.
Got
And
it.
I can't answer to how long it takes to fingerprint because it,
Understood, ma'am. So let's go back to what you're here to talk about. An LPN is going to do a medical or mental screening on these folks coming in?
it's a series of questions. And what it does, it initiates or triggers, this person needs to then be referred on to mental health. So if they've had, it's a 10-question screening, and that they go through it, and they're not doing an evaluation. They're doing a screening as to whether or not they're stable to come into the jail at this point in time.
How
And they
would-
get referred.
I guess an RN or even a physician wouldn't know if someone was maybe skipped a day of medication that they needed to stabilize a mental problem, and their symptoms aren't presenting at that time, and they don't voluntarily reveal that information to you. It makes no difference who is doing the mental evaluation. Would you find that to be correct?
As an RN, I would have no way of knowing, if I was evaluating that person, that they skipped a dose of medication if they didn't tell me. Sometimes it's a cumulative effect. What I'm assessing is their status at that point.
Do you believe that there could be something that's missed in a mental assessment of someone because it's done by an LPN, that having someone with better medical training may be able to see and assess in the intake process that we're missing by, one, being rushed, as you stated, being rushed by deputies, and having an LPN handle that?
I think the same set of criteria that is used as an RN, I would probably have the same set of abilities as the LPN at that time. If there's any questions, they get referred to the mental health team.
Okay. In the comparison between an RN, LPN, nurse practitioner, or a psychiatrist,
yes,
who has the most training in doing a mental assessment?
The psychiatrist.
Okay. Do you not have a psychiatrist doing these assessments per the contract with the municipality?
It is. I do not believe, and I cannot answer to the specifics of the contract as I don't have it here with me.
Okay.
I don't have it in front of me. I don't want to misstate.
I understand that. So we could have a combination of both the human element failing us from time to time and a problem with, in so much as the contract between the municipality and CorrectHealth or anyone else that may take over.
Again, I can't answer
Okay.
to it.
I'll just say that. I think we've got a human element problem, and I think we've got a problem with the contract.
Yes, sir.
All right. Well, I'm done. Thanks.
Councilman Hudson.
So there was a couple of questions that stood out to me, although I'm sort of similar to Scott. There's a whole litany of questions that we need to follow up with after the meeting, but, excuse me. A couple of them that I wanted to follow up on, and forgive me, my shorthand is probably even worse than Scott, so I'm going to jump around here a little bit. Family notification for inmates who are seeking medical care. Are we required by the contract, or are we doing any sort of family notification if someone is severely injured or sick?
If someone is severely injured or sick, the sheriff's department makes the notifications.
Okay, so that's not a function of CorrectHealth?
No, sir, it is not.
All right, fine, thank you. Is our full population of HIV-positive inmates receiving their medications?
The ones who are ordered medications. Not everyone who's HIV positive chooses to take medicine. Not everyone, if someone is in and out of jail and in and out of treatment for HIV medications, there are certain points where physicians will not initiate new treatment because there's only one or two medications left that's called salvage medications that they can take because their virus is mutated from going on and off medications. Some of those numbers may be someone who came in who's being worked up because they haven't been on treatment. We've referred them. They go to Lolly Camp within the system for their HIV care. We will refer them there, and it may be that we're waiting for their appointment.
Let me ask the question this way. If a patient is HIV positive, they've been prescribed medication, and they want that medication, do they have access to it?
Yes, sir.
Okay, thank you. This is one that just stood out to me. How many spider bites do you guys treat?
A lot of times what is called a spider bite is actually a boil from an MRSA infection. I personally have never seen a spider bite that was diagnosed by a provider as a spider bite. They're typically MRSA infections that become boils.
Is that like a staph infection? Or?
Yes, methicillin-resistant Staph aureus.
Okay, thank you. Of the deaths that we've seen, have any of those been pretrial deaths?
The four deaths that happened in 2019 are the only ones I'm prepared to speak about. And to be very honest, I am not sure their classification issue, whether they were DOC inmates or whether they were parish inmates. But all four of them came in with significant issues, and all four passed away at the hospital.
Mr. Mulder, I think it was, brought up the point that there were no sick calls in August. I believe there's also no sick calls in, and I'm going off memory here, I think it was January. Can you speak to that? What happened there? Why?
There may not have been anyone referred to the physician. The mid-level practitioner, the nurse practitioner there, did a bulk of the sick calls at that point in time. And whenever there's a sick call for an inmate that she feels she needs more assistance with, then it gets sent to the doctor. And so at that point in time, there may not have been any that needed to be referred.
Does it seem odd to you that none would have been referred to a doctor? Is that it certainly as I look at this list of numbers, that seems like an anomaly. It seems strange to me that a referral wouldn't have happened.
And we had a change of medical directors at one point, but I can't tell you what month it was. And so that could have been, but I don't want to say that that's what it was.
Would it have been a staffing change that would have necessitated not sending the referrals?
No. The doctor changed. But I
Right,
can't,
so
I
was
don't
that-
remember what month that was. So that month in August may have been during the transition, but please don't quote me on that. because
Let me ask it this way. Was there a month where a doctor was not available
No, sir.
to receive referrals?
No, sir.
Okay. On your list, I saw no OBGYN exams, outpatient or inpatient. Is that typical of the
Well, no,
for a facility, or are we doing
Depen-
OBGYN visits?
Depending on how pregnant the person is, depending on whether they need to be followed up every 6 weeks, every month, every week is dependent. We did have an on-site company OB service that came in at one point in time, and I believe those numbers are on there. But we have a family nurse practitioner. Let me see. Let me look. Hold on.
Need your additional time?
Yes, please. So outpatient visits,
So
OBGYN was
on
zero.
on-site specialty care, if you look at May, June, July, mine didn't print as well as yours. I apologize.
Okay, OSOB,
That's on-site.
on-site OB, okay, I got you.
And then we have a family nurse practitioner who is qualified to do OB exams, so she is seeing those patients, and were not listed as OB exams because they were being done by the family nurse practitioner. And
So-
then inmates can be sent off-site.
All right, and look, forgive my ignorance on this, but a family nurse practitioner, does that qualify you as a medical doctor?
Family nurse practitioner is a nurse practitioner who is qualified to do those exams. If they find that there is a problem, then they will be referred off-site to a provider.
Do you guys collect data on the number of patients that have preeclampsia or any other high risk?
I do not
births?
in these statistics, but I'm sure it's something that we could.
Can you provide the council the number of births that were high risk?
Surely.
Okay, thank you. The last question I had was, you mentioned there was a health service administrator. Who employs that person?
CorrectHealth.
So CorrectHealth's health service administrator is the one who determines whether or not a claim is substantiated?
Medically, yes. And then
So
can I complete the process of how the
Yes,
grievance system works?
Yeah.
Okay. Then it goes back to
You
the
can do it in
jail.
3 minutes.
Then it goes back to the jail administrator, who then has it brought back to the inmate, who can then appeal the decision as to, I don't think this is appropriate or not, and then it's reinvestigated with our assistance to the sheriff's department.
Okay, I understand. Inmate deaths. Let's go
Yes,
back
sir.
there real quick.
Yes, sir.
How many of those occurred inside of the prison?
In 2019, none.
Okay.
All 4 were hospital deaths.
Can you tell me the nature of those deaths?
One was end-stage HIV, one was a brain tumor, one was congestive heart failure, and the other one was a aneurysm.
Okay. Were there coroner evaluations done on these folks?
Yes, sir.
And was there any sort of medical treatment noted from the coroner that was
No.
not done, that was a contributing factor or anything to that nature?
No, sir. 3 of the deaths were people who had been in the jail for less than a week, came in and then were ill, and we had to send them out to the
So
hospital.
those folks may have in fact been pretrial.
I believe probably were.
Okay. And then the other inmate had been there how long?
He had come in November.
So, okay, so remind me again, 3?
I'm sorry, it was November, and I believe he passed.
November of what year?
I'm sorry, 2018.
And he passed?
I believe it was either January or February. I don't have it, of 2019.
So 3 of them had been there a week, and another one had been there maybe a month and a half, 2 months?
Correct.
Okay. That's all the questions I have. I thank you.
Yes, sir.
You've provided us with a wealth of information tonight. Most notably, I think we've pointed out some holes in our contract. And as I understand it, the mayor has announced that she will be sending this back out to RFP, and I think that's the proper thing to do. So thank you. I look forward to continuing up on this. I want everybody to recognize we have an obligation to protect our inmate population. That is something we have to do. We've also got to manage the cost of this contract. I know that's something a lot of people want to talk about, but it's got to happen. The cost of this contract matters. So this will be a debate. Thank you.
Yes, sir.
Daryl, do you want to say something real quick?
I was just going to say that the mayor did send a note out about the RFP. We have we extended the contract this year to get through the accreditation process. That contract is an old contract that goes back to 2016. A lot of the questions asked about payment and staffing really are provisions that are in the contract. So CorrectHealth is operating under the parameters of what's in there. The game plan right now is to do an RFP by the middle of the summer. We have pulled in a few professional groups that we want to engage in writing that RFP because it is a specialized RFP, and we also want the community groups engaged. I mean, a lot of the concerns that the mayor heard last week with the sheriff and the warden were well taken, and we want those addressed. Thank you.
Yes, ma'am.
Okay, so I guess we probably all are addressing some of the questions that have already been asked, but one of them was to clarify the number of staff per job. How is that determined?
Per the contract.
Per the contract?
Yes, ma'am.
So what's the ratio? What is that? Because I don't have the contract in front of me.
I don't either, ma'am. I wasn't prepared to discuss that at this time.
I heard somebody say they got, but I'll wait on that. Now, I also, I don't know if it was somebody that came up that talked about most of the people that are in Parish prison or they are awaiting trial, so they have not been found guilty of anything. But my concern too, and I think Councilman Hudson may have touched on it, with pregnant women. Have we had any women that have actually given birth while in Parish prison? And how was
No,
that
ma'am.
handled?
They've all been in hospital births.
Okay, but not how. Let me rephrase that. I don't mean in the prison.
Okay.
While being incarcerated.
Yes,
I
ma'am,
guess
and
I should say.
that's on the statistical report.
Okay, and so they're receiving their monthly or bi-monthly or whatever it is, treatment or care?
Yes, ma'am. They have their ultrasounds, they have their blood work, and they are followed by a provider.
Okay, it's the mental health issue. How are we handling the mental health issue?
At this point in
Parish
time, we
prison?
have two psychiatrists who are both there at the facility several days a week. We have a full-time LCSW, and I believe, again, was not prepared to speak specifically to this tonight. We have, the second one is either an LPC or an LCSW, I'm not sure. Licensed professional counselor, licensed social worker.
Because I remember the young lady sitting in the audience brought up the number. It's almost like there's so many overwhelming cases in Parish prison with people with mental health issues. How are we actually providing adequate mental health services to these individuals?
Part of that's a total number of people in the jail that month. So let's say the psychiatrist saw someone today, had them on medication, and they're stable. He may follow up with them in 30, 60, or 90 days,
And how much
depending on that.
How much time is spent with each individual inmate?
Again, ma'am, I don't have that information in front of me.
Okay, so it seems like a lot of questions that are still going to be hanging from.
Yes, ma'am, and if I can get those questions, I will make sure that y'all get the answers to them.
Okay, let's see, what else did I have? Oh, somebody spoke about the conditions, and I know we don't want to hear anything about building a new prison, but when I hear of spiders and bed bugs and mattresses, and I know that's not your issue.
Yes, ma'am.
But a
I
lot
have
of
no
the things
control over
that
it.
are there, like if they're spiders, if they're rats, I heard somebody say something, I thought I heard her say rats in the stew. I'm not sure if I heard that. I was hoping that, in the food, okay. So, but to me, a lot of those things that are happening can contribute to health conditions in the prison and within.
Yes, ma'am.
If there are rats, if there are feces in the food, if there are spiders, if there are bed bugs, all those things can contribute to the health of an inmate while they're in there. And again, a lot of these people haven't been charged with anything. They're just there because they're too poor to bail out.
Yes, ma'am.
And so, to me, and I know, again, some people don't agree, but I still believe that we need another parish prison, something that is safer, that is because people are in jail doesn't mean that they don't need to have clean, decent conditions to live in. Clean bedding, clean sheets, clean food, bathroom facilities, medical facilities. Because if you're rendering medical services within a dirty facility, that's like defeating the purpose.
Yes, ma'am.
And so, I know that that's not your issue, but again, there are issues that need to be addressed if we can in terms of the bedding in parish prison, the food that is being fed. It's almost like feeding people poison so they can go to the doctor or have to have health care or health on site. and I'm not saying that that's your fault, but there seems like there's so many issues within the prison, some that could be better addressed from Correct Health, surely, some that probably the sheriff needs to be here to answer, because I think some of the questions that are being asked tonight are facility questions and not necessarily questions for Correct Health. So this seems like a deeper, ongoing conversation. I am glad the mayor has put this back out. And I know that if I know Reverend Anderson and her group, they are going to stay engaged and make sure that this RFP that goes out the door has what's in it for the provider that will be selected to continue the service within the system.
Yes,
Not
ma'am.
kicking any holes at you, but I think, like someone said, our inmates deserve better. They're inmates. They're not necessarily convicted of anything, so that means that they're not criminals. They're just been arrested for something.
Yes, ma'am.
Yeah, so I've had family members that have gone to Parish prison, so I know what the conditions up there. We've toured it. It's not safe. It's filthy. I wouldn't want my worst enemy to go to Parish prison. I understand we need jails, but we need to do better by our inmates. They are still citizens of this parish, and we need to treat them decently. Thank you.
They gave me the contract. Would you like me to answer as to how many?
No, because there are still so many other questions that are hanging
Yes,
out
ma'am.
there to be answered. So I'll write down other questions that I have and add to the
ma'am.
list that's been out here, that's already been given. So thank you.
Okay.
Councilwoman Green.
I guess my first question is in regards to your title. I think I missed it at the beginning of your presentation.
I'm the Director of Clinical Services in Louisiana. I'm a registered nurse.
Of clinical services in Louisiana,
Yes, ma'am.
but you work for Correct Health.
I am Correct Health's Director of Clinical Services in
Okay,
Louisiana.
got it. So my questions, I guess, are more so about reporting and the accountability and the business portion of the medical services. So it starts with the external audit. There was a question about if there is an external audit. Have y'all ever had one since you've been working at Correct Health?
Not that was asked for by the parish that I'm aware of, no, ma'am.
Okay. And have you worked in this field before?
I've been in corrections for 27 years.
In your 27 years, has there been any external audits done that you know of?
Yes, ma'am.
Okay. And I'm asking because I was handed a book that says the National Commission on Correctional Health Care.
Yes.
Then I did a look in some of the paperwork that was provided, and a little Google search. I saw that there was the National Institute of Corrections, and then the NCJRS. Are any of these commissions the ones that will do your audits, or are those that you report to?
No, ma'am.
Okay.
I don't believe there is an entity that governs. The only people that come in and do audits at all that I'm aware of is the Department of Corrections.
Okay. And there was a question about an independent examiner. I think Councilman Hudson asked that for your grievances. Is there an independent examiner?
No.
It's just the person that works for your company?
Correct, and then it goes back to the warden, who then goes back and screens it, goes back to the inmate, and they can appeal it.
Okay. And how often is the Department of Correction, are you guys reporting to them so that they wouldn't have to do an audit?
They do an annual inspection in all jails that hold Department of Corrections inmates.
Do you know what time of the year that is?
It could be, I do not know when East Baton Rouge is.
Have you had one this year or last year?
I believe so, yes, ma'am. That would be the warden who would be able to answer that for you because they come in through. They do come through medical, but it all goes through the warden.
And is there any reporting that the medical services has to do to the warden, who has to do it to the Department of Correction?
I do not believe so.
Thank you.
You're welcome.
Councilwoman Wicker.
Thank you. I just had a couple of questions, and I want to just concur with Councilman Hudson's comment that, this whole process has sort of identified sort of a lot of gaps and holes in the system that we definitely need to address. I also want to concur with Councilwoman Collins Lewis. We were together, I think, Cantana, on that tour, and it was just absolutely horrible. Just really awful conditions. So that is something that we've got to be able to address, especially, Matt was mentioning that, 33 and a third days on average that individuals spend, in that, I think somebody mentioned the pretrial issue, which in some cases is more than the maximum that their sentences is even allowed for, which is just sometimes unheard of. But the question that I have goes back to the inmates with the HIV. And so the question dealt with whether or not, how do you handle the individuals that are HIV positive who may refuse to take their meds, and that population that's non-HIV? Are they all together, or how y'all managing making sure that individuals are not?
Corrections does the classification as to where inmates are housed. Inmates are not segregated due to the diagnosis of HIV.
So even the ones that are not taking their meds, they can be in with everyone?
Yes, ma'am.
Okay. Thank you.
You're welcome.
You done, Councilwoman?
Yes, I'm done.
Banks.
Thank you.
Yes, ma'am.
Your mic, please.
Has anyone from Parish Prison ever written a formal complaint or requested any kind of changes as it relates to your operations, your medical, other than that you've taken too long for?
Can you clarify for me, to whom are you referring me? Inmates, other medical staff, other?
I'm sorry, yes. Has anyone from the warding or the sheriff department ever written or any formal concerns regarding the way you run, other than that the intake may be taking too long?
Not that I'm aware of.
Okay. Have you all, considering the fact, you know the conditions and it may be attributing to inmate sickness, have you all ever written anything to the warden saying this is a problem and that's increasing the health care problems with the inmates?
We have a quarterly, what's called a MAC meeting, and issues as far as sanitation and those things are brought up at those meetings.
Okay, so have you all ever, in those meetings, indicated that there were any issues that you needed them to address?
I have not reviewed all of those to be able to answer that
Have you
appropriately.
participated in them?
I have in some, not in all.
Okay. When you aren't there, who's there?
The health service administrator is there, and she's the one who runs the meeting. Her name is Phyllis McNeil, health service.
Oh, Ms. Phyllis, who is here?
Yes,
Okay.
ma'am.
So does she work for CorrectHealth
Yes,
as
ma'am.
well?
Yes,
And she's
ma'am.
a health?
Service administrator.
Okay.
She's a registered nurse.
Okay. So I'm looking at the staffing matrix that's a part of the contract. And one of the, I do see the health service administrator.
Yes, ma'am.
I see the director of nursing.
Yes, ma'am.
I see the medical director.
Yes,
I
ma'am.
do not see director of clinical services, the position
Because
you hold.
I oversee our 11 facilities in Louisiana. I'm not stationed at East Baton Rouge.
You do what?
I oversee, CorrectHealth has 11 facilities in South Louisiana, and I oversee those. I'm not stationed at East Baton Rouge.
So you really don't have any firsthand knowledge?
Yes, ma'am, I do. I was there for 8 months,
Oh,
assisting to get ready for the accreditation. Yes, ma'am. I
So
do.
you were there 8 months in the 3 years, right? 8 months in the 3 years?
And I was there daily in an 8-month period of time. Okay, I was like
So you don't
there
know
at that facility.
So you don't know a lot of the historical. You just know the tidiness that was necessary for accreditation for the most part.
Well, no, I was there when we were first looking at the facility and we first toured. I was there. I was there for the first several days of the contract, and then I was assigned somewhere else.
In 2017, right?
Yes.
Okay.
16.
Okay, 2016. Yes, it was approved.
And I was there for several months in 2017.
Okay, but
and then I was back
nothing-
in 2018, and I was there for some months in 2019 as well.
So that brings me to the other thing. As it relates to the nursing directors, how many director of nurses have you had in 3 years?
I believe 4.
Okay, our records show 6 in 3 years.
I'd have to go back and look at the
How
Miss
many-
Phyllis was promoted.
How many health service directors have you had in 3 years?
1, 2, 3.
3. How many director of nursing? You said, I'll just say 4, some say 6.
What Miss Phyllis was promoted.
No. We talking numbers, not names.
Okay,
so
but-
between 4 and 6, correct?
Yes, ma'am.
How
Yes,
many
ma'am.
medical directors have you had in 3 years?
2.
How many director of clinical that's you? How many has the entire had in
Me, 1.
3 years? That's you?
Yes, ma'am.
From day one? Okay. So within our facility, we haven't really had any stability as it relates to the administrators, because we've had 3 health services, 6 nursing directors, 4 medical directors.
Two
Who's been
medical
here?
directors, ma'am.
2 medical directors. Who's been here from beginning to end? Anybody. From the day that you all took the contract, 2017, till 1920, is there one employee that has maintained employment?
We have several nurses who have been there,
How
but not
many?
in a managerial position. I don't have those numbers in front of me, ma'am. I'm not prepared to speak to that.
On an average, how many you think maybe?
I can't even venture. I guess I would have to go
More
through
than
the
10 or
statute.
less than 10?
Approximately 10.
10? Okay. You'll be able to provide me those names?
That would be up to corporate. I can provide you the numbers. I'll send the question. Yes,
Okay.
ma'am.
So,
Yes, ma'am.
Councilwoman, you want your additional time?
One other thing. So, and I don't know if this parish, now when medical service was under the city, of course, we're self-insured. So, of course, the city parish was responsible for paying out any settlement. Now and that was when the budget was $3.5 million. Now that we have a $5.7 million budget, who bears the responsibility to pay out claims for medical neglect?
Councilwoman, you want your additional time?
Yeah, please,
Okay.
I'm sorry.
I would have to defer that back to corporate, ma'am. I
Scott,
don't have
can
the
you
answer.
tell us? So if we're paying $2 million extra, are we still paying for lawsuits? Andy? Sorry, Andy.
I believe that CorrectHealth, again, I don't want to speak incorrectly.
Andy, when someone sues us for medical neglect, for instance, what we probably will happen with the last one, who pays that amount? Does CorrectHealth, that we're paying almost $6 million, or do we still have to pay that?
The city pays it. It comes out of city parish funds, out of the general fund, in most cases, in all cases. But everything has not been explored. So I hate to answer something definitively, but in the past, it's come out of the city parish fund.
So we're paying them, and when they screw up, we have to pay
I'm
for
not going
it.
to answer that question.
All right, got you. Okay, but that's what it. Yeah, okay, go ahead, Darryl.
I may correct one thing, because we looked at I know the issue came up about the cost of the contract. It was $3.2 million
Right,
when
and it
we
goes
did
up.
it internally, but we were paying the medication. So under the CorrectHealth contract, they do the medical care and they also provide the medication. So that kind of makes up the.
Yeah, but we did, when we broke this up before the contract, it did include medical. It didn't include the medication as well.
Well, because I had finance
Now,
check
before they used to apply a lot of it to the inmates' insurance, and also whereas they aren't, another problem, they aren't taking the time to do that. So that's why it's higher, because they aren't taking the time. When these people can actually go to hospitals, they're not going to hospitals, even though they have insurance, because like I say, they are citizens, but it's because CorrectHealth is not taking the time to get all that kind of information and make the proper referrals. I have one more question. I think Cherie, or somebody who can tell me the number of deaths prior to 2016 and of the 41, and how many of them occurred 2017 under CorrectHealth. Just that, and then I'm gonna thank you. So of the 41, then break down how many happened during what span, pre-CorrectHealth, and how many post-CorrectHealth?
From 2012 to 2015, there were 25 deaths. From 2016, once CorrectHealth got the contract, there's been an additional 17 deaths.
Yeah. Okay, so
there was 25 pre-CorrectHealth and 17 under CorrectHealth.
So 17 people have died in 3 years, but in 4 years, twice that many died before CorrectHealth.
That is correct.
That speaks mountains for me. Thank you so much. Huh? I don't have a ma'am.
Thank you, ma'am.
Thank you.
You finished, Councilwoman?
Yes, sir. Thank you.
Ma'am.
Councilwoman Riker.
Thank you, sir. For us non-medical professionals, can you tell me what a PEC is?
Physician's Emergency Commitment.
And is it correct that you said earlier that you guys do not do those?
We do not do them on inpatients because there's a problem with getting an inpatient psychiatric facility to take someone who's in custody because they don't allow the armed deputy in the unit.
So what's the alternative?
They're treated in the jail.
So if there were this person, what's the alternative to that if you had that ability to do that? Isn't it a 72-hour hold?
It's a 72-hour, a PEC is a 72-hour hold in the hospital so that a psychiatrist can see them and make a determination as to whether or not they need care. After that 72 hours, they can leave.
Right. So
it's up to them.
Tell me the process in the facility, in the jail.
If somebody comes in who is psychotic, if they're first coming into intake, we'll defer them to the hospital.
Okay.
So that they can first be screened and see what's going on. Is it metabolic? What is it? If it's somebody who's come in who is then showing signs of mental health needs, then they will be treated in the jail by our psychiatrists.
And what's that treatment like?
I'm sorry?
What's that treatment like? Do they go in a general population? Are they in
No,
isolation?
there's mental health housing lines if somebody is having a problem.
Is there a time frame?
It depends on whether or not one of the mental health providers determines they need to be on that line for safety reasons.
And when we talk about mental health issues, what about people who are suicide risks?
There's a suicide line.
Okay. And is that a different facility, a different area as well?
Yeah, the mental health areas are all in a particular area of the jail, and it's set up in a line.
Okay.
Okay, and so there's single cells where the inmates are then kept, and deputies are monitoring them.
Okay. And what about does substance abuse issues fall under mental health?
Yes, they do. One of our counselors or LCSW sees them, determines whether or not they have an underlying mental health issue other than substance abuse to refer them to the psychiatrist. And if they don't, they're referred to there are several other groups within the jail that they're referred to.
Okay. Whenever you have these people come in and you suspect a substance abuse issue,
yes, ma'am.
How do you analyze that part?
Well, we interview the inmate to determine whether they use benzodiazepines, whether or not they're using heroin, opioids, depending on the type of drug it is, alcohol. And if they come in with a current use of that substance, then a provider is called, either doctor, nurse practitioner, or PA, is called, and they're put on a detox protocol. And at that point, they're referred to a mental health as well as a medical provider for follow-up.
How many people can be provided space who need to be in the 72-hour hold facility or area? How many people?
We don't do PECs within the jail.
So
PEC is something that happens, a physician emergency commitment is something, if somebody was psychotic, we could have one of our providers do a PEC if they were being released from the jail.
Okay, so that person would go to the hospital, correct?
Yes, ma'am.
But if you have someone that is a suicide risk, and you need to isolate them or you need to have them under observation.
Yes, ma'am.
How many areas do you have or how many places do you have for those people?
How many cells are there?
Yes.
I don't have that directly in front of me.
Is that
right now.
considered the line that you spoke of earlier?
Yes, ma'am. Yes, ma'am. And they're seen daily by a mental health professional.
Has anyone ever been pushed prematurely into population for limited space? Are you aware of that?
No, not that I'm aware of.
Thank you.
Okay, Jen, I'm just going to make a few, and I'm going to let you go because I appreciate all the questions and the answers you've given us and being here today. From what I understand, between 2009 and 2020, there have been 47 deaths. 2/3 of those deaths have been outside of East Baton Rouge Parish Prison. Is that correct?
I'm only ready to answer for 2019 at this time.
I understand.
Sir.
Okay.
I apologize.
That's okay.
I don't.
They are in custody, but they are outside. They're off-site. They're either in another parish They're in a hospital.
Yes, sir.
They've had work release.
Yes.
There's 2 work releases.
Correct.
You've had homicides.
Correct.
You had suicides.
Correct.
Suicides are the leading cause of death as far as in prisons.
Mhm.
In
Yes,
2014, from the Bureau of Statistics, from DOJ, it was like 32%.
Yes, sir.
We averaged 10%.
Yes, sir.
Okay? As far as deaths in jails, from DOJ, Bureau of Statistics, a jail that averages 142 inmates has 0 deaths. A jail that averages 363 has 1 death. A jail that averages 1,683 has 2 or more deaths. So you're looking at jails, and ours is the jail is about 1,600, 1,800, that's about where
Yes,
we're
sir.
at.
Mhm. Yes, sir.
So we average 2 or more.
Yes.
So that is, I gave you your time. This is my time. I've got what I've got from the Department of Justice. Okay, so it's my turn though. Okay, I get my 5 minutes. Okay, it's my turn. So with the inmates we have out of parish, and we have inmates that are in, we have over 2,000 inmates.
Yes.
Okay. Due to, I'm going to say this, I think as far as North Baton Rouge in health care, in primary care, I think we lost a lot when Earl K. Long was closed. I think
Yes,
they
sir.
have. And would you say that you think that inmates that are checked in, that are probably the demographics, the socioeconomic, would you think they're probably not as in good health, sicker, as far as respiratory problems, heart disease, diabetes? We have the #1 HIV. You said someone passed away with.
Yes.
We have those
Yes, sir.
issues.
Yes, sir. I believe that.
When you have someone come to the jail that is an emergency need, they go straight to the hospital.
That
you
is
don't
correct.
touch them. They go straight to the hospital.
Correct.
What as far as anybody that needs urgent care? Maybe not emergency, but they need urgent care. You give them that urgent care when you check them in. I mean, you give them dental, you give them health, you give them mental, and you, as far as what urgent care you need, you're giving them.
Yes, and we have access to a provider 24 hours a day. So if somebody needs an antibiotic, or if somebody has an infection, they can call the provider on call and get those medications started until they can follow up.
Okay. I guess my next, comment or question is the NCCHC accreditations.
Yes,
Are
sir.
these the same, as far as you're held to a standard, a criteria? Are these the same people who do it for hospitals, nursing homes? These are the same group?
No, it is not.
Okay. Who would do the hospitals or?
JACO does the hospitals, and the states usually do the nursing facilities.
Okay. But you, as far as accreditation, you are held to a standard.
Yes, sir.
I just think in looking at it, I think we need some improvements. I have said this, and Donna has said it, and I've said it for the last 2 or 3 years, and I'm going to say it again. As much money as we spend sending inmates and people out of the parish, we could be building another parish jail somewhere else that is modernized, that has medical, and as far as also the sheriff's office, because it's so outdated, they need help too.
Yes, sir.
Ward Grimes does a fabulous job. He is great to have for Baton Rouge and the sheriff.
Yes, sir.
Not to say we don't need improvements, we do, but I think with the jail, and that's one of the things that I tried to do, I'll just take my extra few little time, is that some of these millages, and I've preached this since I've been here, that we've got on some of these agencies, and we don't move some of these millages around to a public safety, and I've tried to tell this to the mayor as far as what we need to do as far as a prison and public safety, and it's deaf ears. And nobody wants to touch certain agencies, so if we can't touch them all, I'm not going to deal with them. That's going to be for the next council to deal with. But there's money out there to move around. There's money where certain agencies are getting millions of dollars, and they're in better financial situation than the city parish. But I think my main thing and my understanding is with the 47 deaths, 2/3 of these deaths are off-site. They are off-site. And so, Councilman Welch, I'm going to let you, I'm done.
You know, one of the biggest things, and we have, and Scott's absolutely right whenever it comes to, I mean, we've talked about the condition of the jail. You know, to lay this only at one group's feet, I think is disingenuous. I mean, this is something that needs to, first off, you know, one of the biggest things, they shouldn't come to you. I mean, you know, there was a plan in place to get people out. Most of the people that are in there are pre-trial. They need to not be there to begin with. They need to be able to be moved out quicker. They get resources. When they come into prison, the parish has to pay for that whenever it comes to their health.
Yes, sir.
Whenever they go outside of the parish and they're in other jails, because, you know, I mean, if they're convicted, then most of the time, especially if they come from here, they're going to a DOC facility, so it's theirs. I think we need to take a look at this not in pieces. I don't think we necessarily need to look at this as one, you know, let's do something with healthcare. I think healthcare is something that I think there's some gaps that's been identified, but this needs to be taken as a holistic. This needs to be taken as, you know, the system ensuring that people are going through the system faster than what they do. And so, you know, whenever it comes to this, I know that y'all did, you know, that there's some things that we can do, and we're talking about deaths and numbers, and don't misunderstand what I'm saying is any death that happens, you know, it's an unfortunate deal. My grandmother just went through it, and I can blame it on the hospital just as quickly as I can blame it on old age.
Yes, sir.
But at the same time, you know, if we take responsibility through, then we need to make sure that everybody's getting the health care that they need. I also think, though, is that it starts from not having them there to begin with. So, you know, not for pretrial stuff. I mean, there's some things, but there's some people that are in there for misdemeanors that don't need to be there. So, thank you.
Okay, council members, I need a motion to receive the presentation, the report. Motion by the chair, second by Amoroso. Thank you. I appreciate your time. Thank you.